So public health, we know, is what we as a society do collectively to assure conditions in which people can be healthy. Right? That's the job of public health. It's not about brainwashing, it's about environmental change. That's what we're after. But we also know that when we look at all public health successes, whether they be occupational injury or whether they be immunization or smoking, we know that it's not just the funding. The funding is a means to an end. Essentially what we have to accomplish is we have to do strategic convening and partnerships. That's one of the key issues in public health. We need to have program public health capacity and infrastructure. We need to have policy development and implementation, and we have to have the research and the evidence base. If we don't invest in that, and if we don't invest in all of it, we can't just invest in one piece of it. If we don't invest in all 4 pieces of that, we can't have public health success. And so the way I think about injury prevention as a research practitioner is that injury prevention is what we as a society do collectively to assure the conditions in which people can be safe and healthy. And please note, I put safe and healthy, and for me safe and healthy is one word. Because if you aren't safe, you cannot be healthy. And that's the missed opportunity in this country, in that if we truly addressed safety, then our people would be healthier. Right? And my biggest concern, because this is where I work, this is where I started with brain injured children, is how to protect our children's future. Injury is the leading cause of death in childhood, hands down, by itself, number 1. But play is the work of children. Children learn through exploration, and so therefore when children are injured, they are injured doing normal things, developmentally appropriate normal things. We can't blame them for being deviant. And one of the things that's fascinated me is that if you really want to understand childhood injury, you have to understand the way that the child reacts or interacts with the environment, and for better or for worse, they're in constant interaction with that environment. Now, the reason I became so fascinated by this was what I call the pediatrics board exam puzzle. So I've worked with pediatricians for years, and once I was at American Academy of Pediatrics giving a talk, and somebody said, Carolyn, why do so many pediatricians not get injury prevention? Why don't they talk about injury prevention? I said, I want to ask you that question differently. I want you to explain to me how it's possible that when you write a full day of board exams in this country to become licensed to be a specialist caretaker of children, that in all those hours, you can probably list the injury prevention questions on one hand. In other words, it's possible to be board certified as a pediatrician in this country and know nothing about the leading cause of death in the children you are being trained to take care of. How is that possible? Because if it's not on the board exam, it's not in the residency. And if it's not in the residency, it's not in the medical school. And we understand the consequences of that. It's fascinating. So then I thought, well, why do they do pediatrics anyway? Why do they do it? They do it because they want to take care of kids and maximize and optimize the children's future. And that is the connecting hook to pediatricians. They don't care about injury prevention, but they care about the child's future. And so for me, I have increasingly been reframing childhood injury as not being about deaths or injuries at all. I don't even show data. I say the real issue about childhood injury, it's about protecting a child's fundamental need to live, explore, learn, and grow in safe and healthy physical and social environments. It's an issue of children's rights. It's not an issue of basic injury prevention linear thinking. And we know that injury prevention takes a community, whether we're talking about children or whether we're talking about the elderly. Ultimately, it's really not about the health department. It's a tragedy that, like my health department I just left, 780,000 people, one of the oldest counties in the state, just cut its injury prevention program. No injury prevention program at all, right? But ultimately, it's going to take all of us working together to solve this problem. So go back. How do we then address this imbalance? I think what we need to do is we need to say that we need to make injury relevant to people who don't ever want to work in injury. And they don't have to work in injury. They just have to understand that injury and what we do is relevant to them. And so our perception gap can only be closed by increasing relevance and being very clear about what the challenge is and making that challenge actionable. So, what can we do collectively as a society? We can say we need infants who are the most vulnerable of our society, who cannot be responsible for themselves, to be placed in safe environments, safe sleep environments, right? We need them to live long enough to do their developmental work. We need children safe and able to do their developmental work. And by safe, I don't mean taking them off the playground in the schoolyard because we're so afraid of injuries. Because then what happens? We don't get the ankle injuries, but then they run around like terrorists in the school, right? Beating each other up. And then when they get to the classroom, the teachers can't control the classroom because the kids are bouncing up and down in their chairs. And so for that little time we saved on the playground and that failure to address the fact that they need to run and hang upside down, we can't educate them. Right. Athletes should not be risking their future health and their long-term health for the sake of a win. We need to be protecting them while they're athletes. One of the things that's beginning to emerge from the work of the Prevention Institute is that fear of injury and fear of violence is a major limitation, a major risk factor for people not being physically active and not eating healthily. People are afraid to be in their communities. And so as we begin to move the issue of physical activity and nutrition and community mobilization and walkable communities, if we don't address the issue of community safety, we're going to be investing money for nothing. We need workers protected from harm. We need senior citizens able to live independently. That hip fracture will shut down independent living for almost a third of the people who are injured. And then we also need to not forget the survivors. We also need to be doing the work which helps trauma survivors thrive after they survive. And so finally, I mean, really this is the question that I just have for all of us, is we're so used to saying we can't do it, and we're so used to being the orphan child of public health. But for me, the issue is what great injury prevention challenges would we attempt if we knew we couldn't fail? And I think that's for us is the ultimate question. If you remember the Moon Challenge back in May 25th, 1961, do you remember the second half of the sentence was not just that we would send somebody to the moon, but we would return him safely to Earth. Very precise, very focused, very actionable. And so two challenges were met. One challenge was met when we walked on the moon. The second challenge was met when they returned safely to Earth. And that was 42 years ago, but what we have not successfully met yet is the challenge of having people go to school and go to work and come home safely. And we also haven't got to the challenge of what happens when people go home, their home isn't even safe. That challenge, we've taken people to the moon and we've brought them back safely, but the challenge of having them travel our roads and go home safely, that we have not met yet. And so I don't think injury prevention is about numbers. I don't think it's about, killing people with data. I think it's about reframing the issue, which is very compatible with what we do in public health, which is that injury prevention is not just about tragedies and injuries and cost savings. It's about every person's health, well-being, and the fundamental need to live and work in safe and healthy physical and social environments. And it's that connection to so many aspects of public health, which is what gives injury prevention its urgency and its relevance. Thank you.